Hello, I'm Cassie and I have the pleasure of interviewing Dr. Michael Wald, who has been nicknamed the Blood Detective for his keen ability to zero in on health problems and find natural solutions. Dr. Wald also has several degrees and certifications, including board certifications in nutrition. And Dr. Wald, we've been receiving some questions that people have sent via email on today's topic of persistent fatigue.
It's a big one.
Now, Heather says, no matter how much sleep I get or how well I eat, I'm still tired all the time. I'm 27 and I should not be like this. My doctor says that I have iron anemia and recommended that I take iron pills and eat foods high in iron. But it's been 6 months and nothing has changed. What else could be going on?
Poor Heather. Heather, I'm not making fun of you, but you're 27 years old. You have no right to complain about anything. Alright, but to take this a step back, it's a serious issue. Fatigue could be caused by so many things, and Heather, it seems that the iron anemia was part of it. But in your case, Heather, your doctor diagnosed you as iron anemic. You took the iron. I don't know how long you've been taking the iron pills for, but let me just mention, if the iron anemia, which for those who don't know is a deficiency of iron, and in women of this age it's usually due to either heavy menstrual periods, sometimes irregular menstruation and excessive loss of blood over time, which makes you anemic. Giving iron might not fix the issue, particularly if you're still bleeding too heavily, so you're putting in iron and then you're losing iron and you're breaking even and you're wondering why you're not getting better.
I think she's been doing it for 6 months.
Okay, so even 6 months, we don't know what your periods are like or whatever, but let's assume that they're pretty regular. The other cause of the iron deficiency would be dietary. So you'd want to look at the dark green leafy vegetables in the diet, red meat if you eat red meat. These are good sources of iron. Our website is loaded with other food and nutrition sources as well. You can look some more of them up.
Do you have some vegetarian examples on there for people who don't eat the red meats?
Right. Well, as I mentioned, the dark green leafy vegetables, those are good amounts of iron. But you have to realize, and I'm glad you brought this up, is that not all iron is the same. So vegetable iron, so again, like in spinach, which is a very, very good source of iron, that is called non-heme iron. And then meat products have heme iron. The heme iron is much better absorbed in the body. So people say, to me, well, I crave meat when I do, my energy goes up. Well, whether you crave meat or your body just inherently knows that the iron is there and it helps you into better form is one thing. But if we want to rely on plant forms, it's best to take vitamin C or eat vitamin C rich foods along with the vegetarian sources of iron, because vitamin C turns the non-heme iron into heme iron, which makes it much more absorbable. But depending on how deficient a person is, Heather, you've been taking these pills for 6 months, but that doesn't mean you've adequately fixed your iron levels. And when I say iron levels, I'm hesitating a little bit because we don't base anemia on iron levels, serum iron levels. That may be one of the parameters, but we want to look at the red blood cell count, which is usually low or low normal in iron anemia, and then something called hemoglobin and hematocrit. And then there's something called ferritin too, which is a storage form of iron. So I want to look at all those things. If I had that information on you, Heather, I could let you know if you've been taking enough iron. So before we go to other, reasons for fatigue, we always want to make sure that the things that people are doing, like in Heather's case, taking the iron, that you've been doing it right and taking the right amount. So again, just because you're taking the iron, and a lot of our patients make this mistake, they learn about something that's useful, they take the right thing, not long enough, at the wrong dose, and not all supplements are the same. Here's an example of where supplements apparently are the thing to do, because if you have a severe iron anemia, you can't eat enough green leafy vegetables or red meat products without giving yourself, tremendous gas from all the veggies and, constipation or heart disease from the meat. So sometimes supplements, are helping us. So it takes at least 4 months to really fix iron anemia if you have the iron dose right from the beginning, because red blood cells live around 120 days. So you have to go through at least that one cycle of iron supplementation before the cells really start to catch up. And then all those cells have to now circulate to the organs which were sort of fatigued by having inadequate, iron. If you don't have enough iron, you don't make enough hemoglobin, and you need hemoglobin for oxygen and carbon dioxide exchange with tissue, so it can result in fatiguing. So once you fix the problem, it still may take several more months after that. Now I do admit 6 months That sounds like a good amount of time. So I suspect that you have other nutritional deficiencies. If you have an iron deficiency and it's not from, let's say, heavy periods, and it's from the diet, if we have iron deficiency anemia, we probably have other deficiencies in your diet, Heather. So you want to look at vitamin D and the B complex. So someone needs to look at your diet overall. Consuming too many processed and refined carbohydrates and also certain grains which have phytates, which bind to iron, could be limiting your efforts. You might need to take out multivitamins for some extra support, eating more regularly, small meals 3, 4, 5 times throughout the course of the day to balance out your blood sugar, which brings us to another cause of fatigue. So Heather, you might have hypoglycemia. Heather's blood sugar may be too low as well. And you may not know it, Heather, because your doctors may not have paid much attention to it. It may not have been severe enough that it caught their eye, or they saw the iron anemia was so obvious that they ignored the other things. A lot of our patients come in, they say, oh yeah, my doctor said my labs are fine, and we look at it, and we have all these abnormals, but they are ignored, Cassie, because that particular specialist may not have put it together as indicating a specific disease process. Okay. It's kind of bits and pieces, and until they're more well-defined, there's nothing to do. So Heather, again, 27 years old, if it's not your periods, which I still suspect is, you need to continue with the iron, get your blood levels checked again at the 4-month mark, making sure you're on target with your hemoglobin and hematocrit. If not, you're going to need more iron, which, by the way, can be constipating, but buffered vitamin C powder would manage that issue right away. It balances that out. We have information on the vitamin C flush on our website at www.intmedny.com, and we also have articles and other videos about other causes of fatigue. So I think we'll leave it there.
All right, fantastic.
Okay, good. Thanks, Heather.